Hello, everyone. Welcome to another episode of Open Mic Discussions. I'm excited to have Dr. Bishara here today. We're going to be discussing the importance of vitamin D in relations to your overall health and also in the relations to COVID, as well as a study that Dr. Bishara presented to me with gut health in relation to COVID as well. So without further ado, hello, Dr. Bishara. Good morning. How are you doing?
Hi, how are you doing? Thanks for having me.
I'm doing great, and I'm very happy to have you on. Thank you so much.
Thanks.
You're
Um,
welcome.
yeah, vitamin D is a very hot topic, and so is the gut. So these are my two favorite topics. So I'm ready to go.
All right, sounds good. Can you tell everybody a little bit about your background so they know about you?
Yeah. So I'm a traditional, I practice traditional medicine. I'm an MD and I practice internal medicine for over 20 years. And over, I saw that my patient really weren't getting as much nutritional advice and guidance as I would like. And having been someone who's very passionate about nutrition and holistic health, I decided a few years ago to kind of move away from traditional medicine, which, there's nothing wrong with that. And there's plenty of us to do that. But I really felt like there was a need for education and knowledge in relation to how our body works and how food is used as a really important healing source for many of us. I mean, I think personally our body is the best doctor, so I really focus on that in my practice. I focus on gut health, I focus on nutritional deficiencies, and through that, it empowers my patients to really take control of their health. And I've seen dramatic improvements in my patients' health as a result of that.
That's very interesting. It's I'm glad you sent me this study on gut health, and I'd like you to kind of go into that, and then also in relation to COVID as well, how that
Yeah.
took part. My wife is always telling me about gut health. I don't know too much about it, but she's always going on and on about it. And so I told her about it, and she was excited to talk about it. Can you tell us a little bit about that study and what it involves?
Yeah, so it's funny because we kind of stumbled upon this study during the pandemic. My husband is an ICU doctor, and so he kind of had this opposite effect of me during the pandemic, where most doctors' office were pretty much shut down, closed. Everyone was told they're non-essential. But then you had these hospital workers, right? ICU doctors, nurses, and all these critical healthcare workers kind of thrust onto the front line. And so, as an ICU doctor, he was coming home discussing his patients that were really sick with COVID in the ICU. And we started discussing a couple of things, one of which being was that he was seeing a lot of patients with a very high inflammatory marker, one called interleukin 6, which is a very common inflammatory marker that the body releases in response to what it perceives as an infection or any kind of intrusion. And so what he was seeing over and over were these patients that weren't necessarily otherwise unhealthy. I mean, a lot of them were, younger, no quote unquote medical issues, except maybe having a high BMI. And so they started giving them these interleukin 6 inhibitors to kind of calm down that inflammation. And so during one of our discussions, my background also, I do weight loss, and he was kind of asking me, are patients who are, your weight loss patients who have high BMIs, do they have these high interleukin 6 levels normally at baseline? And I said, actually, they do, because they're inflamed, right? So interleukin 6 is a great short-term acute release inflammation, which sometimes is good for us. Inflammation is not a bad thing if when it's short bursts, but unfortunately what happens is people who are chronically inflamed have these chronic elevations of interleukin 6, and that's where really the problem goes. And so they were using these treatments that inhibit interleukin 6 and finding some effect from them. So I kind of just started to do a little bit of research, but what was really surprising, and this is kind of that light bulb moment, was why aren't children getting sick, right? We were seeing that children really were not getting sick at all. And so it kind of boiled down to their gut. And then specifically, we really started digging deep and researching their gut, because we know that children's guts are much healthier than adults. And so we really started kind of researching their gut. And we know this, right? But children have a very high concentration of one specific gut bacteria called bifidobacterium. And
Mm.
believe it or not, it occupies 70 to 80% of a child's gut, right? So that's a crazy number, right? It's a very high percentage. But what was really interesting was not only does it occupy a large percent of their gut, it's a very healthy gut microbe. It regulates a lot of really important immune functions. But guess what also it does? It downregulates interleukin 6. So these people that we were seeing in the ICU with very high interleukin 6 levels, they didn't have enough bifidobacterium in their gut. These people were at risk because of the fact that they were very deficient in bifidobacterium. And contrary to that, children who were developing infections were really able to mount an immune response that was able to kind of calm the virus down, and that's why they weren't getting as sick. So we did a little bit of more digging, and a lot of people were recommending vitamin D, and there's definitely a link. So vitamin D deficiency was definitely associated with COVID severity. But why was it associated with COVID severity? It'll be interesting to tell you that the deficiency causes an imbalance of gut microbes. So when you're deficient in vitamin D, it also causes a deficiency of bacteria in your gut, beneficial bacteria. And so when you have a deficiency of vitamin D, a deficiency of good bacteria, what happens is the bad gut bacteria start to kind of usurp the space where good bacteria should be thriving and keeping the gut lining healthy. So this is really where vitamin D plays a role, where we talked a lot about this. We heard a lot about this in the news, but really nobody was talking about the core issue, which was bifidobacterium deficiency. And so we published the study. There wasn't really a lot of traction about this, unfortunately, in the beginning. And we felt like, why isn't this kind of becoming mainstream? This is information that could really help people. And it wasn't information that was necessarily dangerous or, damaging to anyone. I mean, no one's ever died from taking a probiotic or eating healthy, right? So, we tried as much as we could, and it was a very frustrating process. And then, over the months, I mean, we published a study in May of 2020, which was literally a couple of months after COVID hit the US, very, very early in the pandemic. We really wanted to get it out there as soon as possible. And, every few months, we'd see another study, which kind of was very similar to ours, deficiency of bifidobacterium. And then there was a large Hong Kong study that looked at the gut of patients in the ICU and specifically looked at their stool samples and found the same thing, deficiency of bifidobacterium. And then, since then, there have been, studies coming out kind of confirming this, that really your gut was the most important factor in COVID and COVID severity, along with vitamin D deficiency as well.
Interesting. So let me ask you a question. As far as, okay, so children have bifidobacterium, right? But adults, the problem is they are not having this type of bacteria. Is just the root cause of them not having this type of bacteria vitamin D deficiency, or are there other things that can cause, I guess, what are the causes of adults not having this bifidobacterium?
Yeah. So let me just clarify that adults do have bifidobacterium in their gut, just not as much as children. The levels tend to decline as we age, but there have been some studies that show that healthy elderly adults actually that live to be 100, there was a study on centenarians, they have a very good amount of bifidobacterium in their gut. So it's not necessarily an age factor, it's more of an age plus a lifestyle factor. And so what we've seen is the large amount of processed foods that we consume here in the US and a lot of industrialized nations are killing off the good bacteria. We're not eating enough foods that really enrich our gut, and these include plant-based fibers, because our gut microbes, the good ones anyway, they love plant-based fiber that we can't digest, but they do. And as a result, they digest it and they produce these amazing byproducts that help to keep our gut lining healthy. So it's really more of a lifestyle deficiency. Now you kind of add vitamin D to the factor, and unfortunately, we're also people that don't spend a lot of time outdoors. They recommend 20 minutes of sun exposure a day for most people in order to keep your vitamin D levels adequate. Well, what's happening is, especially during the pandemic, everybody was locked inside, vitamin D levels were low. And in general, Americans tend to not spend a lot of time outdoors. We're, in office environments, we're indoors frequently. And we don't take supplementation. We don't routinely check for vitamin D as often as we should be. So a lot of us, and I would say close to 80% of my patients that have not been supplementing, when I check their vitamin D levels, are low. So a lot of us were very low, and vitamin D functions as a cofactor in the gut along with these bacteria, the beneficial bacteria. So when you're deficient in vitamin D, plus you're deficient in beneficial gut microbes, your gut lining is not as healthy as it should be. Your immune system is largely housed in the gut. And so this is where you start to see that ricochet effect, where you're really starting to get a lot of problems as a result of the deficiency of these two important, things.
Interesting. That's something I had spoke to you about and asked you about as well, and maybe you can dive into it a little bit. And I don't know if you'll know what I'm referring to or if you've seen it. I had read that there's some studies saying that as far as vitamin D supplements and then vitamin D from the sun, they were saying that supplements seem to be a better approach. And my question to you was, at first it didn't really make sense because I think anything natural from the sun would be best. However, I was considering, what if people live in like Alaska or Russia or place or Seattle, I think is cloudy all the time. So maybe
Yeah.
is the reason why they say that supplements tend to be more successful as far as the vitamin D, or do you know much about that?
Yeah, I've come across actually several studies, not just one study, basically saying the same thing, that supplementation is slightly better at improving your vitamin D levels than the sun is. That doesn't mean that it's necessarily the best option. It's really more about, are we getting exposed to vitamin D or not? And you said it, there are a lot of people that aren't able to go out and really absorb the sun and get that 20 minutes every day of vitamin D that we really need in order for us to convert the absorbed vitamin D into what we need in the body. So if you were to ask me personally, which is better, I would always say what's natural is better, right? But we don't always have the option to get what's natural. So you do what you can. And I think the studies were really based on the fact that when you supplement, you're supplementing on a daily basis, you're taking it on a regular basis, and you're able to replenish those levels pretty quickly. That doesn't necessarily negate the fact that sun exposure is also a great source of vitamin D. And I'll give you a perfect example. Sub-Saharan Africa did a lot better with the pandemic than we did. And you don't really find a lot of people who are deficient in vitamin D in sub-Saharan Africa because they're outdoors very frequently. They actually have the lowest, Africa as a continent has the lowest incidence of colon cancer as well. And a lot of it may be attributed to the fact that they don't really see a lot of vitamin D deficiency. And vitamin D deficiency has been linked to several cancers, including colon cancer and breast cancer. So these factors definitely play a role. So I would say, if you have access to getting in the sun every day for 20 minutes, then you know what, that's going to replenish your levels as well, and you're going to have good levels. But if you don't have access to that, or there's inconsistency in your exposure, then supplementation is definitely an option. And I think that's really where the studies came, where they showed that slight improvement is probably because of the fact that it's consistent, right? And you're kind of taking it in, and not everyone is able to expose themselves to sun on a daily basis because of the lifestyles that we all lead.
That makes perfect sense. Let me ask you, okay, in regards to, vitamin D and COVID and so forth, you saw, we've spoken throughout the pandemic as well. As a doctor and someone that's been in the medical field, what were your thoughts when you were seeing the news media coming out and saying, hey, vitamin D is a conspiracy theory as far as it minimizing the effects of COVID? Like, as someone that's in the medical field and, you've obviously done research and reviewed research, what were your thoughts upon seeing that?
I have to say I was very disappointed because, as scientists and doctors, we are taught to approach every novel hypothesis through the scientific method, right? Which is you come up with a hypothesis and you kind of go through it. And we have all this data that shows how important vitamin D is. And so I'm not really sure why that was, kind of, what's the word? Just, I
Pushed,
guess,
yeah, being pushed.
yeah, or just shunted, or but it is really disappointing. And I felt a similar way when we were trying to get our study out, to at least just kind of inform the public. As I said, you can't die from a probiotic. You can't die from eating foods rich in bifidobacterium. And, and believe it or not, now bifidobacterium is actually listed as a first-line treatment protocol. On the Frontline Critical Care Workers Alliance, which is a group of ICU doctors that kind of share what treatments have been working for them. They have a website where they share treatment options for others, other physicians to kind of be guided by. And they have it listed because we've seen now so many studies. And early on in the pandemic, when I had my patients, not one single one of my patients needed to be hospitalized. I gave them high dose vitamin D immediately, zinc, and high dose bifidobacterium and a probiotic. And I have to say, patients of mine that were considered high risk did very well. I had very mild symptoms, and I truly believe that it was a combination of the fact that they got a huge dose of the probiotic and the vitamin D. So here we are 3 years later. I guess hindsight is 2020, but I also feel like if COVID taught us anything, it taught us that we have to take our health into our own hands. We have to do our own research. We have to really put ourselves first and our health first, because, and I guess this is just human nature. No one's going to care more about you than you. So do the research, look into it, and unfortunately, that really wasn't done as much as I would have hoped during the pandemic. But I want people to know that this is something that you can take into your own hands. Eating a healthy lifestyle. This is all things that really improve your health. And it sounds simple, but it really, it's powerful.
Absolutely, and absolutely agree. Now, again, to kind of ask you, in addition to that, as far as looking out for people's health, it's supposed to be, about their health and not about anything else. But during the pandemic, do you think, from your perspective, being in the medical community, that politics were playing a large influence over what was being put out there as, misinformation, disinformation, conspiracy, all these different things? Do you think politics was playing a huge role in pushing out that perception?
I don't know if politics was playing a role. I just know that a lot of scientists and doctors were muzzled and not able to present their findings. Again, we did a scientific method of researching the science that us as physicians and scientists were pretty convinced of, and yet this really wasn't becoming mainstream. And so I do want to add that I'm not necessarily anti-vaccine. I'm really more anti-mandate, anti anyone being forced to do anything that they or their doctor is really not suggesting. So unfortunately, I felt like we as a society didn't really get that opportunity. And I think especially for children who have already that natural immunity and they have that robust gut and they have such high levels of bifidobacterium, they were able to, survive. And I don't think there's any one child on record having died specifically just from COVID. There may have been comorbidities that we don't know about. And there definitely are comorbidities in children that can decrease their bifidobacterium levels, such as obesity and other conditions. But I don't think there was one child that died from COVID. So to mass vaccinate everyone as a whole, I think was very, what's the word? I disagree with it. And I disagree with mandates in general. So that's what was really unfortunate. And, I think the doctor that was using ivermectin, also the same thing happened with ivermectin, right? It was kind of like poo-poo to use ivermectin, but ivermectin's mechanism of action and a lot of medications that were actually working downregulates interleukin 6 as well. It's one of the mechanisms that it works on. But there was another study that came out on ivermectin specifically, and it was found that ivermectin increases bifidobacterium levels as well.
Oh, wow.
So this is probably why it was also helping a little bit. And if you look at countries like India that had a huge surge of COVID early on, but then they started having a protocol where they were giving vitamin D ivermectin to patients, their curve kind of started to go down a little bit in terms of the severity and the response to COVID. So it's unfortunate that that's the case, but here we are. Hopefully we learned a good lesson. I'm not somebody to rock the boat, but I'm also somebody to rock the boat.
Yes.
So, I personally think that it's a shame that we didn't stress lifestyle and diet as the main, even if during the acute phase, fine, then you know what? We saw that the patients who were getting really sick were patients who were overweight, who weren't necessarily as healthy, who were diabetic, who were inflamed, right? Why aren't we educating more about that now in hindsight? That's another thing that really bothers me.
You brought up a few good points of something that I've thought of. I'll kind of touch on the last one you made, and then discuss the other points, kind of see what you think as well. As far as the obesity item, recently you've probably seen where we're like glorifying obesity. There's the I forgot how they put it, like I forgot the term they use, but basically glorifying obesity and then demonizing exercise, which is strange because even CNN, and I'm not a fan of any of the news, but even CNN during the pandemic said that people that are obese were 10 times more likely to die from COVID. So
Yeah.
this is interesting. It seems kind of evil to do this to people. I like your cat. Is that
Yeah.
your cat?
Yeah. He likes to always make a
Not a
show.
not a raccoon, right?
Getting on the dining room table, he knows he's not supposed to be there. So
Too
he knows.
funny. We have two cats and they're
Oh,
always
you
up there. Yeah.
do?
And so touching on a couple other things that you mentioned that I noticed is, at the beginning of the pandemic, they were stating that all teachers and doctors and nurses were heroes, right? Which I thought I wasn't buying into. I thought that it was some, conditioning people to think a certain way. And then what was interesting is after the vaccines came out and doctors and teachers and nurses refused to take it, there was a lot of them that did not want to take it. That were asking questions and knew about them. There
Yeah.
were no one stood up for them. The same people
Yeah.
saying they're heroes, no one stood up for them.
Yeah.
So,
Absolutely.
you know,
Yeah.
that
Also
was,
very fortunate.
yeah. And then the last point that you were talking about in regards to data with kids, early on, I was debating doctors and nurses like you've had with a lot of them that were pushing crazy stuff. I was showing them because I like to research on my own, and I was looking at data not just in the US, but across Europe as well, as far as COVID and affecting age groups and people with comorbidities, taking all into account. And I use it as an example. Italy was known as like the hotbed for COVID, right? Yet when you look at child deaths, they were next to none unless they had comorbidities
Yeah.
already. And so when I
Yeah.
that the doctors and nurses would ignore it and they're still pushing the vaccine on children, which in my mind, I was like, this is criminal. It doesn't,
Yeah.
why are you doing this? You're supposed to protect people.
I think human nature is one where it's easy to support people that are generally accepted to be supported, and then as soon as the tide waves change, then most people are not renegades, most people aren't fighters, unfortunately, right? Because I think we need a lot more of those kind of people now. And so I think it's just it's not fashionable to go for the underdog, because then you might get taken down with that underdog. But I agree with you. And there was actually a large study done in Italy, of all places, in September of 2020. I know the doctor who did this study, Dr. Claudio De Simone, who gave very, very high dose of probiotics to a control group of patients that were hospitalized. They gave one control group the standard protocol for COVID, another control group the standard protocol plus his probiotics, a very high dose. And that contained obviously bifidobacterium. And that group did a lot better than the other group. They had 8-fold decrease in respiratory symptoms. Not one single one of them needed to be transferred to the ICU. And this study was also blunted. Nobody heard of this study either. This was a big study too, in Italy. So I don't know. Here we are. But be your own advocate, do your own research. Your body is capable of amazing things if you listen to it and if you feed it properly. It's like driving a car, right? You can either not take care of your car and just put the worst kind of gasoline and just not take care of it and it's going to break down a lot faster than a car that's being taken care of and given, you know, the best fuel and maintenance. Same thing with your body. Your body's, you know, even smarter, and it knows what to do, and it's always looking for survival. So ultimately, you have to feed it what it needs to function at its best. So that would be my take-home message: is your body's capable of great things. Let it do that just by feeding it well, taking care of it.
I completely agree. So Dr. Bishara, thank you so much for your time. It's been wonderful. Can you, first of all, send me the study, if you can find it, the one from Italy that you're referring to? I'd like to share
Sure.
that. And then for those of you watching, I'm going to be sharing any studies that Dr. Bishara has discussed that she shared with me, also linked to her Instagram, and basically so you can follow her. She provides a lot of a wealth of great information. So thank you, Bishara, for being on my podcast today. The information you have presented is gold. So I greatly appreciate it.
Thank you so much for having me.
You're welcome. So everyone subscribe, like, and most importantly, comment on whichever platform you're watching. Give your feedback or any questions you might have. Okay. Have a great day, Dr. Bishara. Take
You too.
care.
Thanks.
Bye-bye.